Hello everyone, I am Dr. Krishna and today I am going to present the most important topic of not just for UG student but also PG as well, because this is very important and has a lot of function as well, and it's also considered as the most important organ of our body. So let's get started. The name of organ is a heart. So without heart pump we won't live more, right? So the heart, basically people consider this figure is very complex and difficult, but if you are preparing for the NEET or any other competitive exam, it is not necessary to do or draw the exact figure of the heart. But for the explanation, the heart has a four chambers, right? So the fourth, this is a left side and this is right side. Now you say this is your right, so why you have written the left? I have written the left because the reason is this is my right probably, but this is the patient's left. So that's why according to the patient we have to write it. Okay. Now the blood passes from like this. So I think why don't we consider it like this? Slide downwards. Slide downwards. Okay. Now this is our four chambers. Four chambers, right? This is right atrium, right ventricle, left atrium, left ventricle. Now the blood passes from the right entry into the right atrium by the superior vena cava. Now this blood is passes from the superior vena cava is a deoxygenated blood. That's why it is a blue in color. So this is a deoxygenated blood. This is a blue. Now why don't we show it in by blue color, right? So this is a blue in color because deoxygenated. Now this blood is reaches to the right atrium, now reaches to the left ventricle. This blood, deoxygenated blood, reaches to the left ventricle now through the tricuspid valve. Right atrium blood reaches to the right ventricle through the tricuspid valve. Now this right atrium, right ventricle, the blood is passing further like this. So this is our pulmonary artery. This is pulmonary artery, and this is again our deoxygenated blood. Deoxygenated blood. Okay. Once this reaches to the lungs, this deoxygenated blood reaches to the lungs and purify. Here the lung deoxygenated blood become a oxygenated, right? This is a blood red in color. Clear? Now this deoxygenated blood will reaches to the left ventricle through pulmonary vein, right? And this oxygenated blood from left atrium to the left ventricle through bicuspid valve or mitral valve. Mitral valve, right? Now this oxygenated blood is now reached to the left atrium. Now this blood is reaches to the systemic circulation. This oxygenated blood is now reaching to the systemic circulation through arch of aorta. After some time our energy is utilized, then this oxygenated, now the blood is reaches to the systemic circulation is oxygenated. For after some times when we get tired or something like that, so this this oxygenated blood is become a deoxygenated. So again this red blood is become a blue after sometimes, after some energy or after we tired or exhausted. So this is blue blood now after some times and reach to the again superior vena cava, which is a deoxygenated blood. And this is entire cycle going word and reaches to the lungs and then purify it and deoxygenated becomes oxygenated and etc. Thank you. Hope you like this video. Thank you.